talking about muscle spasms in multiple sclerosis and how to recover. If we haven't met, my name is Pam Bartha, and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. I was diagnosed with multiple sclerosis over 35 years ago, and this topic is so important because the vast majority of people diagnosed with multiple sclerosis are going to experience muscle spasms. We call it muscle or spasticity, and it's incredibly painful. There's certain medications that we can use to try to manage it, but the medications really don't work. So the exciting thing is this will be a very productive talk because I'm going to share with you the steps that you need to take to actually recover from spasticity, from the muscle cramps, the stiffness, the drop foot, all of that. So basically what I wanted to share with you is that when in the Live Disease Free plan, we have served like thousands of people by now. And many of the people that we work with have been diagnosed with multiple sclerosis and suffer with spasticity. So, what we have learned over the years, and through my own background of being a teacher and an educator, and I have a science degree and doing a lot of research, so we've really come to kind of put the science together with what works for people. And so the nice thing is that this approach, the Live Disease Free approach, we do not have to live with spasticity. We do not have to live with the stiffness, the drop foot. The best thing to do would be to reverse it before it's a real big problem, to catch things early when we start getting the light symptoms before they become a real big problem. But it can be reversed. So for people that have had drop foot for many, many years, we have found that that has been able to be reversed. So this is going to be a talk that will give you lots of hope, and I'm really excited to share this with you. So let's first talk about what spasticity is. So if we are talking about spasticity with respect to the standard of care approach to treating multiple sclerosis, they say, yes, that's very common. Up to 80% of people have spasticity, but really we don't know what causes it. There is no cure. We're going to just try to manage it with certain medications and maybe some physiotherapy, occupational therapy, things like that. And it's incredibly painful. It's kind of like a permanent Charlie horse where eventually our muscles become so stiff. I'll talk about the different types that we can have just really quickly so that we understand how serious this is and how important it is that, if there's a way to resolve it, it's really important to resolve it. So it's one of the most common symptoms in multiple sclerosis, but not just MS. People that have had a stroke or people that have cerebral palsy, spinal cord injuries, traumatic brain injury, but also multiple sclerosis. So all of these conditions, people can suffer with different types of spasticity. And spasticity is a symptom where we have a lot of tightness. We could have cramping, like the Charlie horse cramping, and sometimes it's like a permanent cramping, stiffness, and it can really impact our wrists and our ankles where we can have like drop foot. And basically what we're told is that there's a breakdown in communication between our brain, our central nervous system, and our muscles. So normally, if we want to move our muscles, our brain, like we're thinking about it, and our brain is going to communicate with the muscles to contract or to release, and that will help to move the muscles. But there's some kind of a breakdown, and so things are not working. The communication is not getting through, and then we end up with contracting muscles that should not be contracting. So with multiple sclerosis, we know that a really big part of the diagnosis of MS is using MRI scans. And with the MRI scans, that is where they're looking for lesions in the central nervous system. So this is a very important part of how we're diagnosing MS. And I've done lots of videos on that topic. You can look on our Live Disease Free website to find out more information about that. But basically, so with multiple sclerosis, there are certain lesions in certain parts of the central nervous system, and they believe that it's just our immune system that's attacking our nerve tissue, and that our immune system has kind of gone haywire, and it for no reason, it's just attacking our own tissue. And we totally disagree with that at Live Disease Free. The science disagrees with that. There's so much research showing that various parasites will cause um, these lesions in the central nervous system. Lots of research. So there's this disconnect between the MS, the group of people that are deciding how we're diagnosing and treating MS, and the world of science. And I don't know why. It may have something to do with funds or money. I'm not sure. But and honestly, like, some people just don't know. You're taught a certain way, you believe a certain way, and you don't know other unless you see the science. And if you're not looking for it, you don't see the science. So we know with MS there's lesions. We know that in the world of science that parasites cause lesions in the central nervous system. I did a whole talk on that before. And we know there's many different types of parasites that can infect or get into the central nervous system. So look at our blog posts about that. With spasticity, there's basically, it shows up in 3 different ways in people that have MS, but also other conditions. So it's not just MS. Other people with neurological diseases can have these too. So where you have a limb that is hard to bend, you can't bend it. So your leg or your arm, or you may have where a limb is bouncing. So like if you're trying to straighten it out, it starts to bounce. Or if you're having a really painful Charlie horse, and they're really painful. They're not like a little Charlie horse that comes and goes, which is painful enough, but they can be really strong, that can persist, or they can just leave you with like a really bruised feeling muscle. So these symptoms can last for long periods of time, prolonged periods of time, and cause muscle, joint, and bone problems. So although spasticity can happen in any limb, it's more common in the legs. And so, for example, some type of spasticity, it might be where it's really difficult to bend the limb. So it might be extended and it's difficult to bend, and other times it's difficult to straighten. So either it's difficult to bend, or it remains bent and you cannot straighten it. So different types of spasticity. And it can be aggravated by sudden movements or position changes, extreme changes in temperature, humidity, or infections, and can be triggered by tight clothing. So these are all, information you would get from the MS Society, just kind of explaining what it is, but they don't know what causes it, and there is no cure, according to them, for sure. So common examples of spasticity is sometimes we have a tight fist. So like we may not be able to, like our fingers are clenched, or sometimes they can be like clenched downward or clenched in a fist. Our wrist can be turned in. We can even have it where our arm is pressed up against our chest. And it's extremely painful because it's like our muscle is in a permanent contraction, right? And so we're trying to take medications that would help to ease the pain and suffering that we're going through, but it's brutal. It's absolutely brutal. And if there are solutions, we need to share them. And that's what this talk is all about today. Is I want to share the solutions with you, because you don't have to live with spasticity. We've had so many people recover from, like, one lady, her hand was clenched for 40 years. And then one morning she woke up and it was open. We had several women like that couldn't use her hand, but one lady, it was 40 years. And drop foot, where people cannot, it's basically where normally you can wiggle your ankle, but with drop foot, your foot is kind of permanently seized downward and you would trip over it. So you have to use this brace to kind of pull your foot up. It's extremely painful and horrible. And it's not necessary that we have to deal with this. And that's what's so frustrating, is that our system, we can give people these simple solutions that don't cost anything, and it can make a big difference. And then if we treat the parasites that are causing the spasticity, we can recover. And yes, the more time we've had the parasitic infestation, the greater the parasitic infestation. It might take more time than somebody who's catching it really early, but it's still worth it. Absolutely still worth it. So then, of course, the muscle spasms, they can cause other problems with our balance and our coordination and our muscle movement, and of course pain, and really decrease our quality of life and cause us to feel depressed because we're in pain. Anyhow, for people that are newly diagnosed and listening to this video, you want to avoid all of that. You really, really want to avoid all of that. So there's different types of treatment options. So there's braces to hold your foot up. There's different exercises that would be encouraged, and oral medication to hopefully soften the cramps and soften the pain, injections, Botox injections, and also surgery. But what's really interesting, now I'm going to switch gears right now, and now we're going to talk about the world of science and the world of Live Disease Free, where we have served hundreds and hundreds of students from all over the world. And recovering from spasticity is a pretty common thing that our students do. And sometimes it happens a little earlier and sometimes a little later. But just looking at science, and I've shared this before, but Dr. Alan McDonald found small roundworms in every MS subject that he tested, in the central nervous system of every MS subject that he tested. Really significant finding. And I've done talks on it, so I'm not going to talk any more about that. You can find all that information on our blog post on Live Disease Free, small roundworms in the spinal fluid of MS patients. And on our blog post that I always do at the end of the week, where I summarize my notes and also the video, just shortening it down, that's where I will share with you also links so that you can just go to different blog posts quickly to get that information. But in the animal world, in the veterinarian world, they've known that when these small roundworms get in the central nervous system of domestic animals, so horses, cattle, sheep, goats, dogs, etc., cats, they cause all the symptoms of multiple sclerosis, including spasticity. So, and there's science, and I was just looking at studies today where the small roundworms in the central nervous system cause lesions also. So there's many different parasites that cause lesions. Think about a lesion as being an ulcer, right? And an ulcer is involved with infection. It's like your immune system is trying to deal with some kind of infection. And that's what I consider lesions to be. They're pockets of inflammation in the central nervous system, and that would be infections. So in animal studies, and this has been known for over 100 years, well over 100 years, that when these roundworms, so just one specific type of roundworm, and they call it cerebrospinal nematoidiasis. So cerebrospinal nematoidiasis, nematodes in the cerebrospinal fluid. And this is where animals can have ataxia, they can have poor muscle coordination, they can have difficulty walking and balance issues, and they don't have hands, but their limb coordination, speech, swallowing, eye movement, spasticity, like paralysis, numbness. It's just shocking, all the similarities with animals that have roundworms in their central nervous system and MS symptoms. Like, it's crazy. And so now to talk about, just like, I literally spent just not even an hour before this talk just kind of going through doing searches, right? And what I do is I look for credible, like, papers, scientific peer-reviewed papers, and just looking to see, like, is there any research showing, other types of parasites linked with spasticity, even in humans? And yes, there is. So for example, one health website said that pinworms or Ascaris worm infestations can be associated with painful muscle spasms. So Ascaris worms are the really large roundworms that a lot of our students have been passing, and pinworms, they have been associated with muscle spasms. Malaria also contributes to or causes contractures. So remember when I said there was this like permanent muscle contracting, like where the hand, the fingers is like clawed, like a claw, or like that, or the wrist is pulled down, or the arm is pulled into the chest. Those are like contractures where you have this really strong muscle contraction that's permanent kind of thing. And so malaria has been known to cause that. And malaria is one of the most common parasitic diseases worldwide, and we really don't test for it. We really don't look for it, but there have been outbreaks in Canada and the United States and different parts of the world years ago, like in the 19th and 20th century. There still is some, I just looked, and there still are some cases of malaria in Canada. So it's not something that our doctors are looking for because they're basically told that that's all been dealt with. But that's just an example of a protist, a single cell parasite that can cause muscle spasms. And then Lyme disease, it's also associated. So it says it's believed that the bacteria can get into tendons. So the Lyme spirochetes can get into tendons and muscles, into our discs in our spinal cord, ligaments, and the linings of nerves, including the spine, causing inflammation, muscle spasms, and pain. And I've actually showed you in one of our previous videos how Borrelia has been documented to be found right in the myelin sheath of a nerve cell in, I think it was an Alzheimer's patient. So Dr. Alan McDonald has shown that Borrelia is present in the central nervous system of MS patients, and he has also found and documented the spirochete, the bacteria that causes Lyme disease, in the myelin sheath of brain cells, brain nerve cells in Alzheimer's patients. So this is all confirmation, but when they're present there, so when they're present in different parts of the central nervous system, but also in tendons and muscles, they can cause muscle spasms. So maybe it's not always that the parasites are in the central nervous system that are causing spasms. It could be that some of them are actually in our muscle tissue also. And then tapeworms may lead to serious infection called cysticercosis, and that causes muscle twitching and spasms. So I've talked about neurocysticercosis, which again, Dr. Alan McDonald found these little bladder sacs of immature tapeworm larvae in the central nervous system of every MS subject that he looked at. And so these little immature tapeworms, they end up in our central nervous system, but they can also end up in our muscle and have this like little cysts in our muscles. And then finally, I just wanted to share, so schistosomiasis would be flukes, which are flatworms. They're more related to the tapeworms. And just one case study that I found, a spinal cord schistosomiasis in US patient causes spasticity. So it's out there, but there's this disconnect and it's a downplay of, it's like, well, we don't know what's causing the spasticity. It's just a symptom of MS. It must be the damage in your central nervous system. It must be, and it must be just that your immune system is just attacking your nerve tissue for no reason. But then all of this other science, it's like, well, if tapeworms or flukes or bacteria or protists, if they get into your central nervous system and cause infection, they can cause spasticity. Or even if they're in your muscles, they can cause spasticity. And it's like, okay, so we don't know what causes spasticity, but parasites can cause spasticity. Why don't we see if there's parasites in MS or in other diseases? It's like, no, we don't want to do that. There's no value. The panel that decides how MS is diagnosed and treated, there's no value in looking for infections or parasites. Nope, we're just going to look for lesions. We don't know what causes them, as long as we know that lesions are there in certain places, and you'll have certain, clinical tests where they're looking at your reflexes, et cetera. Then you have MS. We don't care what it is. We've got good treatments for it. But we don't have good treatments for it, do we? We do not have good treatments for MS. It is so frustrating. I'm sorry, but it's just so frustrating. So let's talk about how we recover from spasticity, because that's probably why you're listening. So what we have found with our students that work with us in the Live Disease-Free plan, the first step we take, so these are people that are dealing with like MS and other chronic diseases, like serious chronic diseases. So they're infested with parasites. So the first thing we do is we stop feeding the parasites so much. And when you decrease their favorite food, which is carbohydrates and simple sugars, then they're less active. That means that they're producing less poisons, they're causing less problem for the immune system. The immune system doesn't have to fight them as hard. Inflammation starts to go down, it starts to decrease, and we start to have a lot of symptom improvements, including less spasticity. Actually, one student that just joined not even 2 weeks ago, I just welcomed her, I believe, last week, and she is just starting to follow the diet, and she is not in North America, she's in Europe. We have students all over the world. And she shared, I do feel better. My balance is better already. My legs are not as heavy and spasms are almost gone. She said, and I'm having a daily bowel movement. So, this is a student that is just starting to implement the Live Disease Free diet. And you can find the guidelines for the Live Disease Free diet free on our website, livediseasefree.com. I think it's under the research tab in the main menu. You'll find the diet guidelines. You'll also find videos on YouTube. You'll probably find enough videos on our website there, but also on YouTube, there's a playlist of the diet, what I eat for breakfast, dinner, and supper, and lots of videos. So the getting the carbs down, and that's the strength of the Live Disease Free diet. It's highly nutritious. It tastes wonderful. It's very simple, but why people notice less spasticity and many other symptoms decrease, especially the bladder issues, that really improves a lot even within the first 1 to 2 weeks. It's because we are we're just making life a little miserable for the parasites. They're not as happy, they're not as active, they're not producing as many poisons, and then our immune system is not fighting as hard, and we have less inflammation, we have less spasticity. So that's the first step. Really, really important. Another thing that we can do to just double check or make sure, we can make sure that we're not deficient in calcium, magnesium, and other trace minerals, because when we have a parasitic infestation, they produce a lot of acids. And when they're producing a lot of acids, then our body is going to use up a lot of our minerals to keep us in the safe zone of, not of being slightly alkaline. It doesn't want to be acidic, and it uses minerals to buffer the acids. And so we become deficient in different minerals. And so we have to make sure that we are and also our food is very deficient also in calcium and in iron and in different types of minerals. So we want to make sure that we are adding in more minerals into our diet, especially calcium, magnesium. So sometimes for some people that helps. It's usually the spasticity is caused by the inflammation from the parasites, but sometimes we can notice that there is some symptom improvement with adding in more minerals too. And it's just good for everything. When you're more alkaline, you feel less stressed, you have less anxiety, you just feel more peaceful. Everything is just better. And then also, there's a couple of creams that our students have found helpful, possibly at the start if you want to. And this is just to manage symptoms. And that would be Hyland, HYLAND, leg cramp cream, or TheraWorks, THERAWORX foam. And so you can put them right on, let's say, your calf or your arm, wherever you're having the spasticity. You can apply those creams, and they're just adding, I believe it's just magnesium, maybe some calcium too, but it's just adding minerals to that area. And that can help a little bit. But really, the biggest improvements will come when you decrease the food to the parasites. And so that there's one thing I just want you to be aware of. So you'll have the guidelines, which are free. They're on our website. And some people will follow it and they'll have huge improvements. They can have their spasms decrease and all kinds of other symptoms improve. And others will say, I'm following it, but I'm really not noticing a difference. And if they're not, then there's a couple of reasons. Number one, their carbs are still a little bit too high. They might be way lower than they were before, but they're still a little too high. So getting down to the 30 total grams of carbs total, you can use a Chronometer, which is a free app. So if you're still 50 and above total grams of carbs, you're really probably not going to notice huge changes. But when you get down to that 30 total grams, and it's pretty challenging to get down that low, because you just have to really be very cautious of even which vegetables you eat. And we really limit nuts and seeds and fruit in this time. But it's life changing for people, right? Like look with the one student I just shared, and she just shared that yesterday. We just had our call yesterday, and there's a whole bunch of other improvements that students have shared. But in like 2 weeks, to be able to have improvements in balance and your spasms are almost gone, just to change your diet. And she's working on having daily bowel movements. So of course, constipation is part of the issue that we have from the parasites, and we have to resolve that before we start treating. So those are a couple of creams we could use. You could also, take some extra minerals. You could actually, a lot of our students are taking extra magnesium to get the bowels moving, so they're really not deficient in magnesium, but making sure they're having enough calcium and magnesium. trace minerals, getting the carbs down, all of those things will help even before you start treating. But then we've noticed that when you're using the right treatments, and it's not exactly the same for all of our students. So with MS, we've noticed that a lot of the students, they have a lot of roundworms, but some of them could be really large and some of them are very small, like what Dr. Alan McDonald found in the spinal fluid. Those are tiny, like you'd hardly, they would be difficult to see with the naked eye. Whereas some of this, I've got videos and not videos, pictures, and on video also of what our students have passed, and that again is on our livediseasefree.com website. You can actually go and see, large roundworms that in MS, and you'll see a bunch of pictures of what's passed. And again, remember I shared with you that ascaris worms and pinworms, so ascaris are the bigger ones and pinworms are smaller ones, but they're roundworms, all of them, and they are linked with muscle spasms. And some of you, like maybe, if you have a family member who's got MS and you're just listening out of interest for parasites, maybe you've noticed you have like these little muscle twitches sometimes. Those are signs of parasites. I'm certain of it. They're not normal and your body is not overwhelmed yet, but those are like little warning signs. So there are so many people that don't have chronic disease, but they get these like, and even like where your finger will curl down or your toes will curl down, and they don't have MS, but that is a sign that they're dealing with parasites. And sometimes it's just worms, not always. Sometimes it could be protists, etc. And that's why it's better to work with a plan where you have like a strategy and you're really considering the different types of parasites, to not just go, well, I'm just going to take this one worm medication and see if it helps me. That could take a long time to see what works. And then are you even taking the right dosages to be effective for what you have? So trial and error like that, especially if you want to get rid of this painful spasticity, it's better to work with a proven plan. And that's what we have with the Live Disease Free plan. So I'll go to your questions right away, but I just wanted to share, like every Tuesday we have our call, and the students get to share their successes. So these are people that are on the journey to recover from not just MS, but other chronic diseases also. And I just wanted to share a couple of their successes. I'm going to leave their names anonymous just because they're in the process, but I'm actually going to be interviewing another student this week and I'll be publishing her video. And she doesn't have MS. She just was bedridden with pain. She used, I think, a walker. And yes, she did use a walker and she could hardly walk. She couldn't function and her life is completely different now. And that's maybe, a couple of months into treating, and she's passed a lot of large parasites. A lot of small ones we can't see, but a lot of large ones. So yesterday, the successes that came in, one of our students, she has recovered from MS, and that was probably 2 or 3 years ago. And then now she started her own podcast. It's called Well Worth It, and her name is Morella Petrucci, and she is an amazing wellness champion. She's in Australia. Just love her to pieces. Today I got a text from one of my students in the past, and she's going to be in a book. There's, I think, 11 or 12 successes of people that have recovered from MS, and her story is going to be in there. She did our Live Disease Free plan many years ago. She said, I'm still doing fantastic, and you'll see Sarah on a lot of our videos. She started taking up running 10Ks after MS and doing the MS bike tour and physically fit, just amazing. So all of these people that we've worked with years ago, and then I shared a couple of weeks ago a few different successes. So Vicky is in the UK, and she now has this wonderful, she's doing yoga. And then another student, Melissa, she has a health food company. She's been about 10 years free of multiple sclerosis. She had to relearn how to walk. Melissa did. And so she's written a book, and she also has a health food company called something Cheats, but it's like healthy desserts. You can't have them until you've recovered from the parasites. But then once you've recovered, then you can. But I mean, she's fit, and this is life after. She hasn't seen a neurologist for 10 years. Amazing. So, and then we work with Marissa, works with us. So there's Melissa and Marissa. There's a lot of others, but I'm just thinking of Marissa and Marissa works with us. She's a coach, and she has been coaching our students for 3 or 4 years. Same with Lisa May, has coached our students also. She's a nurse that's recovered. So all these people, they're getting better. They're getting rid of their spasticity. They're getting rid of all the other MS. They're going on to doing things that they're passionate about. So, like, even with Marilla, she has a wonderful background in admin, but once you get well, you want to help others get well. And now that's what she's doing. And same thing with all of these other beautiful wellness champions. So there is hope for you. But if you keep sticking with the medications for the spasticity and the medications for the bladder and the medications for this and that and the Botox, it's extremely painful and it's depressing and it's awful. But when you treat the cause, when you treat the parasites, and there's a little bit of work going into figuring out, okay, which ones do we have? Which ones do we have to treat? But it's way easier than living with spasticity for sure. So, and then another student, so this is nice to share her success because I have so much admiration and respect for the people that are the most disabled. And it doesn't matter what people tell them, what their family tells them, what their doctor tells them. They know in their heart they're dealing with parasites. And they're just like, the tortoise and the hare. And they're just, I'm going to do this. I'm going to apply the best I can. And I know that I'm very disabled and I don't have a lot of support. And so she has been just following the plan. And she's been getting better slowly. And because she is quite infested and she is not able to handle the full dosages of the parasite treatments, but she's still getting better and she's handling more and more. So sometimes we can treat more aggressively. The more prep work we do, the less infested we are. We can treat more quickly. But sometimes, with all kinds of limitations, we work with people that don't have the support and don't, they need to go a little more slowly. But she said, so she said, my eating has not been as good as it has been. It's been around 40 total grams of carbs per day. But she said, I really didn't have the support coming in as much the last 2 weeks, but she's still at 40 total grams of carbs per day. So she's not like cheating or way out of touch. She said, I'm still treating and feeling stronger and more clear headed. I absolutely do better. I feel better when I'm at 30 total grams of carbs per day. My sleep is still pretty good. I'm getting 7+ hours of sleep. So that's a big thing because a lot of our students are not sleeping when they come because the parasites wake them up all night. I'm having daily bowel movements. I had a colonic last week, and the technician noticed that I could move my right foot more, and I'm beginning to be able to move my left toes. That's amazing. Her toes on her left foot. So that's another thing with, paralysis and just toes curling down to be able to start moving that is amazing. So she said, I didn't check in last week because my progress is so slow. I feel like a sloth in the cartoon called Turbo. My family continues to doubt why I'm doing this. But as as slow as I have been going, I know that things are changing. So I'm just so proud of her. So some of us, like you might be really disabled and wondering, is it really worth it for me? Is it really worth it to treat these parasites and give up chocolate and give up alcohol and give up caffeine to treat? It is so worth it. And this one student is showing you that it is. And again, what is so exciting is that even though I can never promise full recovery, we're having so much more recovery than we thought possible. So it might take somebody 12 treatment cycles, but then, they might not have walked for 5 or 10 years. And then all of a sudden they're starting to use crutches and their ankle, it's not having the drop foot and they're able to, walk heel to toe, maybe with crutches, building up muscles, sitting on the bike. But this is why this has to go mainstream, because there is so much more recovery that we can have than we thought possible. We thought it was permanent damage, and it is not most of the time. Another student who's very new, just starting to follow the diet, she said, the MS has affected my right leg. So when I stand up, it kind of leans into my other knee. And she said, I have noticed that in the last week that when I stand up or when I'm driving, the knee doesn't cave in toward the other knee as bad as it used to. So it's a small change, but it's awesome. So she's just starting to implement the diet also. And then I got another update on the same week from her. So she's starting to have daily bowel movements. That's one of the things we're working on: diet, daily bowel movements, and sleeping 8 hours per night. Those are the first three things we're doing to get ready to treat. We do other things too, but those are the three first crucial things we do before we start treating. And then she shared that, let's see here. So she shared, for the last 20 years, I've always had a smoothie and meat for breakfast, and I didn't eat very many vegetables. So now she has cut that out because I've shared with her that when we have these lesions in our central nervous system, those are pockets of infection. They produce a lot of toxins, they produce their waste products, they infect us with their parasites. And when we chew our food, it actually opens up channels and it detoxes our brain. And when we grind up food in a smoothie, then it pre-digests the carbs, pre-digests the sugars, and it makes our blood sugar go up and it feeds the parasites. That's why we don't have smoothies while we are recovering. But she said, like, she's making all these changes. Yesterday, walking through the grocery store, I felt my right foot walking much flatter. It has always felt for so long like I was walking with a fallen arch with my foot leaning more inward. This is a fantastic feeling, and this is the start of healthy healing. So, this is literally just changing diet. So, you're getting a sneak peek into people that are on the journey right now and they're just starting. And so, another student who is not just started, she is starting to treat. So she's in Europe. This is a different student. And she shared last week, she shared that she has been able to get back on her bike and go for a really good bike ride. So she is a young mom and she has multiple sclerosis and she's still trying to work and she's taking care of her young kids with MS and doing the program. But she said, my energy is so much higher than a month ago. She said, I still have a little bit of tingling from now and then, but the intensity is much less than it was before. It's usually after work or after sitting for a long period of time. And then she's like, there's this minced meat, like she's in Europe, and there's this minced meat that I eat, and it's supposed to be clean, but I wonder if there's something in it because every time I eat it, I might have a little bit of tingling after. And that's how crazy it is with these parasites. Very small adjustments. It could be you eat a little bit of ham or bacon that has a little sugar or honey in it, and you get a little bit of tingling after again. And that is why it is so important to avoid processed foods while you're in recovery so that it has not been contaminated with anything. But she's doing amazing. And then another student, she shared, I have lost 20 pounds in total, and this alone makes me feel so much better. So some people don't want to lose weight, but she wanted to lose weight. And it's really easy. No suffering, no hunger. You just eat whenever you want. And it's really easy to lose weight if you want to. And so she's noticed also that she has less itching and rashes, which is amazing. And itching and rashes, and I've done a talk about this before too. You may have heard of mast cell activation disorder. That is a new buzz phrase in the integrative field now. But mast cells are part of our immune system and they're really involved in the innate immune response to parasites. So, when you're making the parasites less active, we notice all kinds of inflammation is going to be settling down, including rashes and including itching. All right, so those are just a few. There's more, but I know that I wanted to go to your questions to see if you have any questions about spasticity. But it just helps you to see that there are solutions for spasticity. You do not have to rely on medications. It's still fine to do physiotherapy or occupational therapy. But the problem is that if you have parasites that are causing a lot of inflammation and causing a lot of damage to your nerves and your muscles, and then you're just working those poor muscles and the parasites are still causing the inflammation and more inflammation, it's very counterproductive. What's better is to decrease the activity of the infection so that you're feeling better, and then your physio and your exercise, your occupational therapy is going to work a lot better. Absolutely. Okay, so let's just see if you have any quick questions here. Okay, how do I do this? All right, there we go. So my spasticity was so bad, you used a medication pump and surgically installed in your belly. After being in a live disease-free diet, you were able to have it shut off and completely after 20 years. Thank you for sharing. That's amazing. That is so common. So it's bad enough when we're taking medications orally, but sometimes we're having the pump installed, so it's uh, it's pretty serious. And hello, Joanne. How do we treat muscle atrophy? So, muscle atrophy, like all the muscle issues, right? What you have to do is it's the parasites that are causing the muscle atrophy. So, you have to stop feeding them so much. So, changing your diet, follow the live disease free diet. And that's why we have animal protein with our fat and our low carb vegetables with every meal so that we maintain our muscle mass. And then as you're feeling better, then you can start to work your muscles, right? It's called take back your mobility. Very important to not just treat parasites, but we want to build back the muscle. But if you are like really sick and you have spasticity and you have numbness and you can't weakness, it's really hard to exercise. You have to get rid of what's causing those symptoms, and that is the parasites. But the diet can also really start helping the process. Yes, the leg jerking is definitely part of spasticity, and it's called uh, clonus. And yes, it's a rhythmic movement. That's all part of spasticity. And it's like some of it is like that, but then other people have tremors too. And tremors completely diminish, whether it's arms or leg tremors or whether it's speech tremors in your voice, they completely diminish. And it's all caused, just always think about inflammation when you're talking about disease. Like if you get in a car accident, that's a different types of inflammation. Or if you fall off your bike or you hurt yourself, you have a fall, that's a different type of inflammation. So the inflammation in chronic disease is caused by parasites. So our immune system, the most important job of our immune system is defend us from different types of infections, parasites. And so when our immune system is fighting, when we have chronic disease, it is fighting parasites. We haven't identified them yet. Our doctors, our standard of care has not identified them, and they're not really interested in looking for the infections, which is really sad, but that's what it is. So think of inflammation as war. So when our immune system is fighting the enemy, there's war, and that's what inflammation is. And that the symptoms of war are pain and swelling and redness and muscle cramps and numbness. All of those things are the symptoms of the war that's going on in our body. And as we stop feeding the parasite so much, we stop feeding our enemy, then it's going to be less active. And then our soldiers can deal with it better. And then as we start to treat the parasites, then our immune system is not overwhelmed with the parasitic load that we're dealing with. So all of these things are important. And then our body just starts to go back to normal, and our body starts to, it takes all the different nutrients from our food and it's building again, because it's like, oh, finally we got rid of the enemy and now we can just do what we are genetically programmed to do. The cells, they know how to run. The design of our body is miraculous. It's intelligently designed. And so all we have to do is take away the stressors, which would be the infections, the toxins they produce, bring back nutrition, different minerals we're deficient in because of the parasites, because of the lack of digestion. Like we're not digesting our food as well. We're not absorbing our nutrition. Our food is not the same. So trying to get a little bit better quality, like right now, get local produce that has been vine ripened, which will have a lot more nutrition in it. But all of these things are important. So it's not like just popping a pill is going to get rid of your muscle atrophy. It's decreasing the stressors and then starting to build back your muscle. Very important. Hi, Kim. And so you said, I can be lying down and get the spasms and cramping in my left leg. What is the best advice to treat this? So I don't know if you listened to the whole talk that I just shared, but The parasites are causing the spasticity, they're causing the inflammation and all the other symptoms that we're dealing with. And so, what we have to do is we start with diet. So, the Live Disease Free plan is number one, get our carbs low. We notice huge improvements with the spasms just by getting the carbs low. And then making sure we're having daily bowel movements and sleeping well, all of those things going through. We have a checklist for healing. And then the next step is to start treating. And then what we do is we take samples of herbs and commonly prescribed parasite drugs, like 1 dose of each, and we go to a practitioner, a chiropractor that does applied kinesiology, or a naturopath that does some kind of energy testing. And we ask them to test us to see which of the treatments are most helpful for the parasites we have. And so we don't have good stool tests, but we can use the testing that they do called energy testing to give us another clue as to which are the best treatments for us. We also look at so how we build the game plan is looking at our health history, the health history of our parents, looking at our symptoms. We have a 14-page assessment form, so there's very specific symptoms for, roundworms, flatworms, different infections like Lyme disease, fungus, whether it's yeast or mold. And so that also gives us clues. So between all of those things plus energy test results, we're able to build a game plan. And we understand that it's not just like the days of, oh, I have strep throat and I just have to go on this one antibiotic to get rid of this one bacteria and I'm 100% healthy. When you have chronic disease, it's called dysbiosis. So we have multiple microbes out of balance. We will have some fungi, we will have some bacteria, we could have Lyme disease, we could have different worms. And so we're knocking back different types of bad parasites and we're building back the good microbes while we're following a holistic approach, building a healthy lifestyle. All those things are important. And that's how we recover. That is how we get rid of the leg spasms, the muscle cramps. So really important, Kim, to take the little warning sign that your body's giving you and address it, turn it around, resolve it. Again, you can start with things like making sure you have enough minerals, right? You can change your diet. Those are two things you can do. And if you still have cramps, then you're like, okay, I think I need to treat parasites, right? And that is what's going to, and then build back the good microbes. That is how you stay out of the danger zone. You don't want to have a disease like, maybe, I don't know if you have one or not, but I have dealt with MS, a lot of other people, or PLS or Parkinson's or ALS or cancer. Those are brutal diseases and we don't have to let it go that far. We can treat the parasites before we become infested. Couple more questions. It is like muscle spasms are absolutely awful. So D, is there a difference between caffeine-free and decaffeinated? So you have caffeine-free and you hope that you can drink it. So decaffeinated is when they take something like a tea or a coffee that had caffeine and they're removing most of the caffeine, and it's called decaffeinated. And that will still have a little bit of caffeine in it. And so when you're recovering, it's better to avoid decaffeinated teas or coffee because caffeine will stimulate us, but it'll stimulate the parasites. And we want to make them quiet. We want to decrease their food. We can't kill them with diet, but we can definitely make them less active. And we don't want to stimulate them with caffeine. But naturally decaffeinated, where it's caffeine free, not decaffeinated. When it's caffeine free, that is fine. So there are herbs like peppermint and ginger, and there's so many different herbs like rooibos teas, raspberry leaf tea. There's so many different wonderful herb teas that are caffeine free. Those are absolutely fine. Hello, Tristan. All right. Thank you, Facebook user. I don't know who you are. I don't see your name, but thank you for being such a wonderful wellness champion. So, Pam, do you have any suggestions or for restless legs? It's all the same. That's the main reason why you have a hard time falling asleep at night. So, restless legs is another symptom of parasites. Again, the same thing. Clean up your diet, get the carbs down, get the processed carbs down. And again, you want a bit of a plan so that you're treating the right parasites that you're dealing with. But make, again, diet number one, make sure you're adding in some minerals. And if you still get the restless legs, those are the little warning signs that if we would have listened to these little warning signs, like for myself, I had gut issues. I would years and years of constipation and eating, if our family ate Chinese food when I was a kid or hamburgers, I'd be laying on the floor with a stomach ache. So I had constipation and stomach pain. When I had my young kids, I was more tired. I just thought that was normal. I didn't have a lot of warning signs, but those would have been it. And then I started to get insomnia, and then I ended up getting a really severe case of optic neuritis. That was the start of MS, complete blackout on my left eye, and then weakness and tingling. Actually, I had a little bit of tingling during pregnancy in my arms, but the doctor didn't have any concern about that. He didn't mention MS, but it was really when my son was 6 months old, then I had the severe case of optic neuritis. So if you listen to the little warning signs your body gives you, it's usually stems from you're out of balance. Your microbes are out of balance. You could have nutritional deficiencies, but if you're eating fairly healthy and you're taking a multivitamin, it's probably more just your microbiome is out of balance. And if you restore balance, the restless legs will go away and you will avoid a disaster in the future. That's really wise to do that. Okay. D, how long did Sarah have MS before she realized that um, what to take when she got better? So Sarah, she was diagnosed with MS. I can't remember all her symptoms. Her videos, you can listen to her videos. She's on our website, livediseasefree.com. And all I know is that she caught it fairly early. So some of our students are really disabled and some catch it early. So she caught it a little earlier, but she didn't even use the parasite drugs. So this was before we knew about the parasite drugs. And she knows that if she needs to use them, she can, but she has been able to just deal with herbs. This is where, that's wonderful. For myself, though, I've noticed a huge benefit in using the parasite drugs because you do get rid of the larger worms too. But she is doing really well. She's physically fit. She's strong. And also another, Melissa, she did not use the parasite drugs either. So I think that the parasite drugs are really more helpful in people that have had MS for a little bit longer. If you're catching it earlier, you could become symptom free. But I think that, treating with the parasite drugs and the herbs, I think that it will help you to restore better balance. And that is really important. But I mean, they have the skill, they know. And once you've treated parasites, it's not like you're done. Like once you recover, maybe once or twice a year, depending on your exposure to parasites, it's a really good idea to treat parasites. But you listen to your body. If you notice, you've been symptom free for so long, and then all of a sudden you start getting a little bit of gut issues, a little bit of gas, or a little bit of constipation, or maybe you're a little bit loose, or maybe you have not as much energy, or allergies are coming back, things like that. You're like, okay, time to do a little bit of cleaning inside and decreasing them. And if you have the skill and you know how to manage the microbes in your body, then you're able to maintain your health. And that's what I've done for 35 years. I've been able to not have another MS attack, live a full active life, but I work at it, right? It's not like you just get free, really good health and I'm over 60, like I'll be turning 62 this month. So it's so worth it. I have 7 grandkids and I can still work full time and I can play with my grandkids and we're gardening and hope to get into a horse again. That's a dream of mine to get back, but it's just time right now. So it's worth it. So you said your brother tried everything and it didn't go on the meds. Oh, I'm so sorry to hear that. I'm not sure who he is. Let's see here. You've had MS, so he didn't go on the MS meds. The MS medications don't treat parasites. That's the problem. I'm not against pharmaceuticals, but the problem is that with the MS drugs, they all suppress your immune system. So they would not have extended his life because his immune system is not what's causing his MS. And I'm really sorry to hear that. I'm really, really sorry. So if the MS medications would treat the cause, treat parasites, and he didn't take them, then yes, they might have helped him. But there's not a single MS drug that treats the parasites that cause MS. They all suppress your T cells and your B cells. And you have had it for 18 years. Um, so what I would do is I would really look, you know, if your brother did so poorly, what we have found and what really is the truth is that we end up with these parasitic infestations and we end up with a disease label, and then it's really the environment that determines how quickly we become disabled and how long we live. So if our diet is not good, if we drink alcohol and we have lots of carbs and we don't sleep well and we do a lot of stressors, then our immune system is even taxed more besides the parasites and we don't live as long. But if we, eat really healthy, getting the carbs down, and we try to balance our life, we do all of those things, then we can actually slow them down a little bit. But we still become more disabled over time because they still reproduce inside of us. They still lay babies and they still multiply, but we just slow them down and we have more time. But it's usually the environmental factors that cause us to go from relapsing remitting to progressive multiple sclerosis, and also determine how long we live and how quickly we become disabled. Really sorry to hear that. It's brutal. And that's why I'm doing this work. I'm doing this work because I'm hoping and praying that someday there will be a change, that someday that this will be taken over by our doctors and by our standard of care, and that we will be treating the cause. And that, if somebody starts to get neurological symptoms, it's like, oh, sounds like you got parasites. Let's try to figure out which ones. Let's treat them and just get on with it. And then we don't need all these different neurologists and different, like, there are so many different types of medical experts and we don't need them. We can literally, it's all the same. It's correcting nutritional deficiencies, restoring balance to the microbes in our body, treating parasites, living a healthy lifestyle. And you could have one doctor that can do all of that. And you could treat people early, catch them early. And that's another reason why it's getting really hard for people to access the parasite drugs, because a lot of people are cluing in that cancer is cured by many different parasite drugs. And so there's this huge industry that does not want that information to get out. So they're really making it difficult for even doctors to prescribe and access to treatments of the parasite drugs, which is brutal. All right. Thank you so much for all your comments. There's lots more comments. Just keep them coming in. We will answer your comments. I'm going to let you guys go because we've gone for an hour now, but I just want to thank you for spending this time with me. And what you can do is you can help me to get the word out. That's the only thing that we can do, is to get the word out. And by the time that more and more people become aware that their symptoms are caused by parasites, that they don't have to live with spasticity. Last week I talked about depression and anxiety. We don't have to live with that. We don't have to live with all these symptoms. There's so much more recovery that you can have than you ever thought possible. It's always worth treating the parasites. So if you found this talk helpful, if you like the information I'm sharing and you want to keep learning, please like, share, and subscribe. And then if you're at the place where you're like, Pam, I've been watching a lot of your videos and I know that I have parasites and I'm ready. I want to be like one of these wellness champions. Then if that's your case, then make sure to watch my masterclass training. It explains all the steps in a Live Disease-Free plan. And then at the end, you can actually book a time to chat with me and see if the Live Disease-Free plan is a good fit for you. And we would be honored to support you. So with that, I'm going to let you guys go and we will talk to you next week. Take care and bye-bye for now.